So, a normal menstrual cycle is anywhere between 25 and 35 days. And that you can class as normal, and it's absolutely fine for those cycles to be moving around a little bit. So you might find that some days some months you might have a shorter cycle, and some months you might have a longer cycle. And that doesn't mean to say that your cycles are irregular, as long as they're within that 25 to 35 day mark. So you can be really reassured with that. Period length, again, that can be very different from woman to woman. So you might find that it's very normal for you to have a 2 to 3 day period, or it might be normal for you to have a 5 day or a 7 day period. Again, that is fine, and that can change as you get older. If you've had a baby before, you might find that your cycles are different and your periods are different the second time around. So again, that's all perfectly normal. So, one of the things that I think is really important is to get empowered with your body and your fertility. And the easiest way to become empowered with your fertility is to start really taking notice of your cycles and, importantly, tracking your natural fertility indicators. And this information really helps you know when you're ovulating. So when you ovulate generally in the kind of 10 to 16 days before your next period. So often we hear people talking about that you ovulate always on day 14. Well, that's not true. And it's only true if you have a 28-day cycle and that your cycles are always 28 days. And even then, ovulation can still move around. So it could be later. So if you've got a longer cycle, you'll be ovulating later in the cycle. So it's not going to be on day 14. To give you an example, one thing that is always consistent is the time from ovulation to your next period. And that stage we call the luteal phase. And that is always between 10 and 16 days. But can really fluctuate and can be shorter or longer is the phase from your first day of your period up to ovulation. And that stage we call the follicular phase. And that is really movable. And the different things that can make that phase longer can be stress, it can be illness, it can be traveling, or just getting out of your routine generally. All of those things can have a factor. So don't worry too much if you're finding that you're not ovulating on day 14. That's perfectly normal. And it is probably because your cycle might be a bit longer that month, or your luteal phase will be a little bit shorter. But a good luteal phase length to support an implanting pregnancy should always be no shorter than 10 days, and it will generally be between 10 and 16 days. So irregular cycles, and I'm going to bring PCOS into this, and I know that was one of the questions. So PCOS, or polycystic ovarian syndrome, is probably the most common ovarian disorder, if you like, that women experience, and that causes various aspects to happen. So one of the things that occurs is you're going to have potentially have longer and more irregular cycles. Some women with PCOS will ovulate regularly and have normal cycles. Some can have incredibly long ones, 40, 50, 60, 90 days even cycles, and maybe only ovulate a few times a year. Majority of women with PCOS will ovulate, but maybe quite infrequently. And like I said, it can even be just a few times a year. And clearly that causes problems with conceiving. So the reason why this happens is a hormonal imbalance. So when you've got PCOS, your testosterone is generally raised, and that then creates a huge hormonal balance with estrogen and progesterone. The other reason is with PCOS, you can have lots of cysts on your ovaries, and that can prevent a really good mature follicle from ovulating. So that's another reason why cycles can be delayed and cycle length increased. Some women with PCOS will suffer with what we call insulin resistance, and that's really where your insulin levels you're not able to absorb the insulin as a person without PCOS would, and therefore that then creates this hormonal imbalance. To get a definitive diagnosis of PCOS, you have to be assessed on something called the Rotterdam criteria, and that's 3 criteria. And the first one is that you've got irregular cycles. The second one is that you have cysts seen on the ovaries. And the third one is that you have raised testosterone or symptoms of raised testosterone. And for women, raised testosterone tends to be increased acne, increased facial hair and hair on other parts of the body where women wouldn't normally want it, thinning of hair on the scalp, and sometimes with some women, weight gain or difficulty in losing weight. But to be diagnosed, out of those 3 criteria, you only have to have 2. So it is well worth observing what's going on in your body, going to talk to GP and asking to be assessed on the Rotterdam criteria. So the importance of identifying or trying to conceive when you've got PCOS is identifying when you're ovulating. That is what is vital. If you can do that, you've gone half the battle. Majority of women with PCOS don't require IVF, but if you've been trying to conceive for a long time, it might be that you find yourself needing that. Most women just need to be ovulating, and there are ovulation induction medications that your doctors can help you with to help promote ovulation. So how do you find out when you're ovulating, and what is ovulation? So ovulation occurs as a result of changes in hormones. So at the very beginning of your cycle, your estrogen levels start to rise and they start to increase, and that promotes the good development of a follicle and an egg ready for ovulation. And then at the time of ovulation, you have some other hormones that come into play, and particularly follicle stimulating hormone, which stimulates you to release that egg, and luteinizing hormone, which again helps you to luteinize the egg, and the egg is then released and you ovulate. And then after that, then your estrogen levels start to decline, and the hormone that becomes really, really important then after that is your progesterone, and your progesterone increases. Now, progesterone is really important because it's important to support an implanting pregnancy, but it's the hormone that makes us feel horrendous. It's that PMT hormone. It's the hormone that gives you the breast tenderness, the irritability, but it's a really, really vital one. So that's how the hormones all change and play a part in creating ovulation. So why is it important then that you should be observing ovulation? Well, it's important because there's only a finite time that we can actually conceive in one cycle. So I don't know whether you know this or not, but the egg only lasts for 12, maybe up to 24 hours maximum. And when you think of it that way, you think, how does anyone ever get pregnant in a cycle? Well, the reason that they do is that sperm can live in the vagina for a lot longer. So it can live in the vagina for about 5 days. Sometimes we've found it living for longer than that, maybe up to 7, but in general, 5 days. Therefore, your fertile window, which is the time that you can effectively conceive, is around 5 days before ovulation, the day of ovulation. And because we're never quite sure when in that 24-hour period you might have ovulated, it could click over to the next day. So you've got about a 6-day window when you effectively could conceive. So the importance then is to work out when that is and then to make the most of that time. So you may be aware of different ways that you can track your fertility. And a lot of women might start off using ovulation predictor kits to identify when they're getting that LH surge, so that luteinizing hormone surge. They can be very good. My personal opinion is that they're quite expensive and they can become quite overwhelming. And I prefer to teach women how to use their natural fertility indicators because A, they're more reliable and they don't cost you anything. So we have 3 natural fertility indicators. You've probably heard of 1 or 2 of them, and maybe not the third. So the first one is your temperature, and this is generally referred to as your basal body temperature. And how this changes throughout the cycle is your basal body temperature is looking at your progesterone increase. So if you remember when I talked right at the beginning there, I talked about ovulation, that after you've ovulated, you get a temperature rise, a progesterone rise, sorry. And your progesterone rise also gives you a temperature rise. So by taking your temperature every day, you can then see when ovulation has occurred. So that's great. That tells you when you've ovulated, but it doesn't tell you when you're getting ready for ovulation. And that is important to know. So by observing your cycles and looking at another fertility indicator, you can start to see and start to correlate this information to give you a better fertile window. So the second fertility indicator, which is a really, really accurate indicator, is your cervical mucus. So whether or not you're aware that you have it, every woman will have a degree of cervical mucus, and that's created by the vaginal walls and the cervix, and it helps to carry sperm to the egg. So that's its general kind of use. It's the passage of sperm, and sperm feeds on the cervical mucus as well. So uber important when you're trying to conceive. And this cervical mucus changes throughout the cycle. So if you can imagine a normal menstrual cycle, in the first few days of the cycle, you'll be having a bleed and you won't notice cervical mucus because it's masked by blood and there may not be any. As that estrogen level starts to increase at the start of the cycle, it starts to create more cervical mucus. And the cervical mucus might be kind of quite thick, quite white, quite clumpy, quite chalky to begin with. And then as you start to reach the fertile time, this transitions to become this really nice transport medium for the sperm, if you like. So if you put the really thick cervical mucus under the microscope, it would all be very fibrous and be very difficult for sperm to penetrate through. But when you start to become fertile, when those estrogen levels are at their highest, the cervical mucus is really thin, slippery. It's often referred to as egg white. I actually don't like using that term because I think, well, why would we be associating it with food? But anyway, that's just my personal opinion. But it's commonly called that. And, you know, to be fair, is quite descriptive. So it can be quite clear. It can be really stretchy. So a little bit like egg white, let's be honest about this. And if you put that under the microscope, then it almost looks like train tracks where sperm can just swim up it really quickly. So when you notice that really fertile secretions, the egg white, then that is your body telling you that you are either about to ovulate or you are ovulating. And you might only have that cervical mucus for maybe 1, 2, 3 days, and then it will transition back down to the thicker, creamier, chalkier, white cervical mucus, and then there'll be nothing. So that's kind of what you're looking out for. So the cervical mucus is going to tell you when you're getting ready for ovulation and when you are ovulating, and the rise in progesterone will confirm that for you. So by taking your temperature every morning, and ideally you take it every morning, ideally at the same time, you take it either under your tongue. You can also decide if you want to use a thermometer vaginally or anally, but once you've decided on which one, for obvious infection control reasons, don't change it around. Most people will choose basal body temperature underneath the tongue, and that's absolutely fine. And then these days, there's so many apps that you can record your temperature, you can record your cervical mucus, and you're looking for that pattern. What I call, or not what I call, but what is called the biphasic curve. And that gives me an awful lot of information about your hormonal health when I take a look at that information as well. So that can be really useful. So that's your 2 indicators. And we tend to recommend using 2. There is a third. It is slightly more tricky and difficult to learn, and you don't have to do this. But if you're finding it difficult to perhaps use one of the other indicators, then this can be a good option for you. And this is the position of your cervix. So our cervix position changes throughout the cycle. So a little bit like the changes in temperature and the changes in cervical mucus, the cervix also changes as well. So when you're in the early part of your cycle and you're not fertile, your cervix is quite low in the vagina. It's quite easy to feel, and it feels like the end of your nose, quite firm. As you become fertile, the cervix moves up in the vagina, so it becomes more difficult to feel, and it feels like your earlobe, so quite soft. So you can kind of tell the difference between those 2 aspects. And you might also feel a little dimple in the very middle of the cervix, and that's where it starts to open, because the cervix will start to open ready for the fertile time. So that's the other thing that you can do. And again, you can record that too and look at the correlation between one of the other fertility indicators.